Hello everyone, welcome to the Research Data Management course run by NHR Global Health Research Center for Non-Communicable Diseases and Environmental Change. I am Niveditha from the George Institute for Global Health India and I'll be leading this module. The first session of this module is questionnaire development, and the objective of this session is to be able to use a systematic approach to questionnaire development and to recognize ways to minimize data loss and improve analyzability of the data at the time of questionnaire development. So there are two parts to this session. In the first part, we cover about the various tools used for primary data collection. In the second part, we discuss about the steps in questionnaire development. So as we saw in the previous module, the data can be a primary data source or could be secondary data. Secondary data in the sense that someone else have collected the data, it is there somewhere at some point of time and you're using it for your study purpose. So this module will be discussing more about tools to collect primary data. So there are various types of tools which are available for data collection. The most common one, which is familiar to all of us, is questionnaire. So these are typically completed by either an interviewer who is administering the questionnaire, or it could be completed by the respondent self or a proxy to the respondent. Examples of these are household questionnaires, or at the individual level, it could be socio-demographic. It can capture socio-demography, health, or exposure-related information. It can also capture constructs such as quality of life. The second type of tool is called the diary, and this is completed by the respondent most of the time. Examples where it may not be the respondent is a child who has to, where a parent completes on behalf of the child. And the examples which collects are every day-to-day activities of lifestyle such as diet, physical activity and smoking, or it could be in certain clinical aspects such as medication adherence or adverse events. A checklist is one type of tool where it is used for example facility assessment. Many of you might be familiar in primary healthcare that you use checklists for primary assessing a particular facility, and it's typically completed by the observer who is assessing the facility. The fourth one is a case report form. In short, we call this as a case report, CRF, which is commonly used in clinical trials, and they're completed by a clinical trialist or a team member in the clinical team. And they are geared to capture information on the patient, the intervention, the patient status during follow-up, any hospitalization or adverse events. The last one is more related to qualitative research, and interview guides are the tools which you develop before you conduct an in-depth interview or focus group discussion. And you'll be learning more about it in the parallel module which is happening, the qualitative research methods. So when we think about questionnaire, many times we set to develop the questionnaire from scratch, which is based on the study's requirements. Partly, even within a study, you might need to collect some construct which is such as quality of life or satisfaction or severity of symptoms, etc., using existing questionnaire. So what we typically do is we search the internet and try to see what questionnaires are available in this area. You might stumble upon the exact questionnaire which you might want to do, but you need to be aware of certain things. The first thing is about, is the questionnaire in the language we want to use? So if it is not, then you might have to look for the existence or you might need a translation. While the first part is straightforward, the second one is more about validity, which is tricky. Validity means, is the tool able to capture the construct which we plan to measure? Is it about, it will be depression or mental status or quality of life or a satisfaction, etc. So how do we quantify validity? So there are certain methods to measure validity, and these are called psychometric properties. So it's a branch of its own, but we need to be able to at least understand, does the tool have desirable psychometric properties? we need to also be mindful that these psychometric properties or the reports of psychometric properties depends upon where the tool was tested. So if you're using the tool in the or you're using the tool in the same context, it's very good. Otherwise, you might have to do some cross-cultural validation. It's also possible that you might not find any evidence of validation. You might still use the tool, but you need to be mindful and be aware that this tool may not be validated and see it as a limitation. The third and most important aspect, which is extremely important, is about copyright. So how do we know a tool is copyrighted or not? You might have to look for it actively. You might also have to go and look at the tool at the primary source where it is put up in the internet. Uh, and when you see, it will be very clear and evident that this tool is copyrighted, which means you need permission before you use. Even if you get hold of the full tool, you might still need to take permission, otherwise you are violating and it amounts to copyright infringement. So there are two types of things which might happen when you seek permission. First thing is there might be a fee required, or it might be that you don't require a fee, but you just need a documented permission from the owner. The second thing could be there is no copyright. So it is available, it's in a published paper, it's an academic output, and they clearly say that anybody is free to use for it. So there's no need to seek permission. What is most important here is you need to cite and acknowledge that you have used from this primary source, because that is else it will amount to plagiarism. So you would be lucky if you get a tool which is in the same language as required. It has desirable properties when it is being tested in the same context which you are going to do, and it either doesn't need a fee or it's not copyrighted. So each one of you, I would request, think about the questionnaires or tools which you might use from the existing questionnaires or tools, and if you have any doubt or any concerns about any questions, I'm happy to discuss during the live session. One more aspect of a tool is we sometimes use the word case report form and questionnaires interchangeably, or we also need to be sure about, while diaries look attractive, but do we need to use them? What could be the disadvantages? So in this table, I present a comparison between these three tools, which will help you to make the decision. The first one is a case report form and is typically used to collect clinical information as they're used in trials, whereas a questionnaire, apart from the facts such as socio-demography and certain exposures, you might also collect information on certain aspects such as beliefs, experiences, perception, and practices. Diaries can also be helpful to capture the same. It can also, but there are certain differences, which we'll see as we go down. The development of a case report form is almost always study specific. You cannot reuse it without changing it to the current study. Whereas questionnaires, you might have existing validated tools, or you might do a study specific questionnaire, you might develop one. Diaries are also mostly study specific. In respect to complexity, case report forms are quite technical and brief, so it doesn't have much explanation. And they use quite not a common language, lay person's language. A questionnaire, because it is to be administered to the participant directly, it is typically in a simple free-flowing sentences, and they are standardized in the sense you have a question number, you have to go in that order, and you have to complete it. Whereas for a diary, while they are simple in language, if it is typically a paper diary, then it might be less standardized. The source of data, case report forms, can capture information from various sources such as medical records, laboratory, or directly some from the participants. Whereas questionnaires collect direct data directly from the participants only, and say so is the diary. Case reports forms and questionnaires can collect information both from past and present. However, we need to be mindful how valid the past experiences, how well they can be recalled when compared to the present. Whereas diaries are if you are very much interested in capturing the present only, and then the diaries could be very useful tool because they are more useful to capture current experiences as by the day or by an hour. There are certain disadvantages, so it is important to know when to use what. Case report forms are very good at capturing facts. It cannot capture participant perspectives. So even in clinical studies, there is a movement that we need to measure participants' perspective about improvement or worsening, and so we have these questionnaires, which we call the patient-reported outcome measures, which are commonly being used. So clinical trials can also have questionnaires in the form of patient-reported outcome measures. Questionnaires can be burdensome. They are not brief, so you need to be mindful of the length, and they can also have validity issues. Diaries are burdensome to the participant who completes, which might lead to non-compliance, and also because they are not standardized, it's quite challenging to collate and analyze them. So you should be mindful when using diary is more advantageous than a questionnaire, with the risk of having to recall, because you can't administer questionnaire every day. You will only be able to administer questionnaire when you meet the participant, whereas diaries can be captured every day. So irrespective of the type of tool which you use, there are some common goals when you are developing a data collection tool. So collect information, it should be able to collect information that is required to meet your study objectives. It should, not only that, it should be able to demonstrate validity, reliability in the sense it should be able to measure the same thing again when you remeasure it, and it should also be able to give you unbiased answers. A good tool will have information about context, that is when, where, and how, the time it was collected, because the data should be linked to a particular context. It should be easy to the persons who are completing it or collecting it, with able to minimize the loss of information which you might have. There should be not too many queries after the data collection, because it might mean that you have to go back and verify. And the data, when it comes out, should be in an analyzable format with very minimal data processing. So with this common goal, how do we achieve this goal? Irrespective of any tool it is. So being systematic, extremely helpful. And that is what I'll be taking the part 2 of the session, which is the various steps while designing a data collection tool. Thank you for listening.